Presentation will be about reconstituted whole blood. At the end of this presentation, blood bank technologists will be able to understand the process of reconstituting whole blood for neonatal exchange transfusions and extracorporeal membrane oxygenation. Also, they will be able to calculate the ideal hematocrit value via the given value table. Selected patients may require whole blood transfusions based on their clinical conditions. Whole blood collected from donors is most often separated into components and is rarely available or used for transfusion. ACL LGH Transfusion Service prepares customized whole blood by adding plasma to RBCs. The hematocrit of the final product is adjusted according to the physician order. Clinical situations which may necessitate the use of customized whole blood are neonatal exchange transfusions and extracorporeal membrane oxygenation. Severe hyperbilirubinemia secondary to alloimmune hemolytic disease of the fetus and newborn is the most common reason. Exchange transfusion removes indirect serum bilirubin, circulating mother's antibodies, and antibody-coated neonates' red blood cells from circulation and provides RBCs compatible with neonates. Extracorporeal membrane oxygenation is a treatment that uses a pump to oxygenate patients' blood outside the body, allowing the heart and lungs to rest. Blood flows through tubing to an artificial lung in the machine that adds oxygen and takes out carbon dioxide. Then the blood is warmed to body temperature and pumped back into the body. This system provides prolonged cardiac and respiratory support to persons whose heart and lungs are unable to provide an adequate amount of gas exchange or perfusion to sustain life. Some of the clinical indications for the use of ECMO in newborns and pediatrics are meconium aspiration syndrome, a condition that occurs when meconium, the first stool of a newborn, is inhaled by the baby before or during delivery and causes lung problems. Persistent pulmonary hypertension of the newborn, a disorder characterized by abnormally high blood pressure in the arteries that supply blood to the lungs. Congenital diaphragmatic hernia, a condition in which part of the stomach and/or intestines protrude through an opening in the diaphragm into the chest cavity. Respiratory distress syndrome, a lung condition usually in premature babies that makes it difficult for babies to breathe on their own. Pneumonia and congenital heart conditions. And the clinical indications for the use of ECMO in adults include patients recovering from heart failure or lung failure or heart surgery as a bridge option to further treatment when doctors want to assess the state of the organs such as the kidneys or brain before performing heart or lung surgery. Also, it's used for support during high-risk procedures in the cardiac cath lab. And it's used also as a bridge to a heart assist device, such as left ventricular assist device, LVAD. ECMO is also used as a bridge for patients awaiting lung transplants. This helps keep the tissue well oxygenated while makes the patient a better candidate for transplant. To reconstitute the whole blood, do the following. Receive and review customized whole blood order for attributes, required hematocrit, volume, and other special requests. Take a note of 2 separate RBCs that may be needed to be reconstituted to obtain a total volume greater than 300 milliliters. For neonate exchange, select a unit that is leukoreduced, irradiated, washed, hemoglobin S negative, and less than 5 days old, O-Rh compatible with baby, and antigen negative for any maternal alloantibodies. Perform component prep in AML function BCP. And then for plasma, select AB plasma. Physically thaw, but do not thaw in BCP. In other words, in the system. Transfer the weighed washed red cells using sterile technique to a 600 milliliter transfer pack. Obtain a copy of the reconstituted whole blood worksheet from the Standard Operating Procedures online and use the table to determine the volume of plasma to add to the RBCs. Complete all lines, and step-by-step instructions are on the right side of the chart. From the chart on the worksheet, on the top line of the chart, locate the calculated weight of the CPDA1 red blood cells. Then on the left side of the chart, locate the reconstituted whole blood hematocrit requested by the physician. On the chart, circle the number where the column from the calculated CPDA red blood cells intersects the row of the hematocrit requested by the physician. The circled number is the volume in milliliters of AB plasma to transfer to the CPDA unit. Once the volume of plasma to add is decided, attach the thawed plasma to the RBCs using the sterile docking device. Allow the appropriate amount of plasma to flow into the RBCs. Seal the tubing and mix thoroughly. In AML function BPC, prepare the reconstituted whole blood. In the value field, enter RWB. Tab through date and time. It will assign the date and time automatically, and then click Continue. Pay attention to some detail here. Scan plasma first. This will use up the plasma unit. Then scan RBC. You will get a warning that component type does not match maintenance definitions. Click OK. A QA warning then will open stating that the input unit expired before output unit. Acknowledge by clicking OK. Then change the volume, expiration date and time. Expiration must be based on 24 hours of date of the washed RBC. Click Save and click Finish. Also take a note, a warning may pop up stating define label type for the following unit requires a product code. Without a product code on file, no label will print. Click OK. At the end, perform a blood label check. Complete the lower left-hand quadrant with the RBC and plasma volumes and plasma type. If the ISBT label printer is unavailable, out of order, or during a downtime, attach a tag with the following label completed.